X5 and Hot 97 present Street Soldiers with Lisa Evers.
I'm so glad you're joining me for this episode of Street Soldiers on 2020 Lessons Learned. I'm Lisa Evers. You know, last year was tough on so many levels and in so many ways, but there were also many examples of triumph over tragedy. As we hold in our hearts the lives that were lost, we also want to take a look at some of the lessons we've learned. It was a year where our greatest frontline heroes were covered head to toe in scrubs and PPE, saving lives from a deadly virus while risking their own. Dr. Ali Haider is an interventional cardiologist. He says they were ready for the long days and medical challenges, but never expected medicine itself to become politicized, with so many lives on the line.
I would think that this is a wake-up call for us to sort of realize that all of us are connected together, what our actions affect each other's actions. And even though we may be different in many ways, we're all humans and we're all being affected in the same kind of regard.
Artist and reality TV star Tokyo Vanity says with fewer distractions, she learned to focus more on her music career. She survived the coronavirus, and that taught her the value of being disciplined with safety measures.
You have to, focus on you and make sure you're safe, but you also have to sacrifice some things and take the proper precautions.
The health access disparities made glaringly evident in 2020 raised awareness at a time when the national consciousness was focusing on civil rights and racial justice. The lesson is unity, says Dr. Jeff GARDERE.
With COVID-19, brown and black people were disproportionately affected by this particular virus. We learned that social injustice is real. We learned that we do have to come together, all of us, in order to be able to beat back and eliminate systemic racism, and that all of us as a country, as a nation, will be better when we support one another.
So how far will these new insights take us? Let's find out what our panel has to say. Joining me is Dr. Jeff GARDERE. He's a clinical psychologist. He's also an associate professor of behavioral medicine at Touro College. Dr. Jeff, great to have you with us.
Great to be on with you, Lisa.
Thank you so much. Also joining us is Dr. Ali Haider. He's an interventional cardiologist and he's an associate professor at UMass. Dr. Haider, great to have you with us.
Thanks for having me.
Thank you so much. Also joining us is Tokyo Vanity. She's an artist and reality TV star. Tokyo, great to have you with us.
Thank you for having me.
Appreciate it. Dr. Jeff, I want to start with you on this. In terms of 2020, we know all the things that went wrong. We know the things that bothered us and hurt us. What have we really learned in terms of our lifestyles, do you think?
That we have made the next evolutionary leap, and we've done it very, very quickly. We've learned that we're able to adapt. We've learned that there are people who are victims of health disparities and therefore have been affected in a major, major way by COVID-19. We've learned that racism has been at the foundation of all of these issues. And that, we psychologically are still, our feet still have not hit the ground, and that there is much more to come, but that we cannot persevere as a divisive nation. We have to come together.
So you see it actually as a positive that people have realized it's messed up for everybody. We're all in this together. We have to find our way through together.
Absolutely. I think the biggest lesson in all of this is united we stand and divided we fall. And we've fallen very far.
Definitely. Tokyo Vanity, in terms of the entertainment industry, a lot of people have really been hurting because so many events have been canceled, so many shows have been canceled, a lot of the performances, venues, all of those types of things. What have you learned this year about your career and about pursuing your dreams?
I'll honestly say that COVID-19 showed us three things. It put some people in a crazy financial situation in the beginning, but a lot of people are in the best financial situations right now that they've ever been in their life. Two, it showed us that we're actually capable of doing anything that we really want to do, but honestly, being out in the world and around so many people, it actually was just a bunch of distractions. And
that's a good point too, that it allowed people to focus in more on what they're doing and what their particular goals are. Let me bring Dr. Ali Haider in. Dr. Haider, tell us about your experience, because medicine has been the focus throughout this pandemic. You've dedicated your life to saving lives. And what has this year been like for you?
I mean, for one, it's been surreal, and it's sort of, even as physicians, we're seeing what's going on around us from the beginning of the pandemic, and it's sort of take a step back and you realize, like, wow, like, how can this even happen? We have so much technology, so much research development that we're picking away little diseases over time, over the years. And next thing you know, this pandemic sweeps across, reveals all these vulnerabilities, these flaws that we are faced with, and it's humbling, right? I mean, we're sort of not used to being in a situation where we're helpless. And this is what it was like last year when this first came. And even simple things like lack of, initially when we lack of PPE and protecting ourselves, and we take that for granted as healthcare providers, keeping ourselves protected. So all these little things we never really thought that we had to put much, much effort into are being revealed. And then confusion. I mean, this disease, as Dr. GARDERE pointed out, is affecting, the Black and Latino communities worse, and, certain communities worse than others. Why is that? Some people are getting very sick and dying, whereas others are not as sick. So there's so much that happened so quickly. And it was a big challenge to sort of weed through that. And, we were forced to learn through that situations. And I think, as a medical community throughout the world, we came together very powerfully and very strongly. And I think we're in a better spot than we were, to some degree a year ago. But it was just, it really was both surreal and humbling at the same time.
See, and that's an interesting perspective. And we thank you for the work that you've been doing on the front line, saving lives with that. Tokyo, in terms of yourself personally, have you known anybody that was affected, or did you change your behavior in any way as a result of what we've been going through?
I had COVID twice.
Oh my gosh.
The first time I had COVID, they didn't know what COVID was. The first time I had COVID was actually in December. Second time I had COVID was in July, and I actually caught it from actually being at the hospital. The first time I had it, I was very sick. We didn't know what it was. It started off with the flu. The next time I had the super flu and strep throat, then walking pneumonia and the flu, then regular pneumonia and the flu, but it was COVID. Then, I had it again in July. I contracted it from being at the hospital. And that time, like, only reason why I knew I had it was because I couldn't smell or taste.
And that was definitely one of the symptoms. How are you doing now with your health?
Oh, I'm fine. Like, I didn't get COVID because I was being careless. Like, you know what I'm saying? I had I fell in a water meter and had to go to the hospital, and that's how I contracted COVID.
And how are you feeling now?
Oh, I'm fine. I just recently went out the country, so you have to get COVID tests and stuff like that. I'm fine.
So you good now?
COVID free.
Dr. Jeff, in terms of this kind of curveball, like Dr. Hayter was talking about, where we always, American medicine is touted as the best in the world. They know there's all these predictive tools. There's all of these things. That element of uncertainty has also helped us to become much more adaptable, much more quickly when there's changes.
Yeah, absolutely. Because certainly this is something that we didn't expect. It's a once in a 100-year event. And we're always thinking, and Lisa, we've talked about this offline, we're always thinking about how, if something happens on this planet, if it's global warming, if it's something like a pandemic, it's going to happen to our children's children. So here we are right now. It's happening to us. Tokyo is an example of someone who's gone through it. Dr. Hayter, of course, has been a frontline worker and exposing himself all the time and doing that work. My wife, a physician, doing the same kind of work. But what we've learned is that, with perseverance, with courage, with relying on one another, that we can bring out the best in ourselves.
Coming up, more takeaways from a troubled time.
That's
Dr.
exactly
Hayter,
right.
what about that in terms, because you had some pretty strong posts about the misinformation that was out, and I could see the passion, there to educate the public about this. What do you think about some of these misconceptions that still persist even as we continue to battle this pandemic?
I mean, it's been frustrating, and I try to talk about it on my page to try to tell folks, fighting that misinformation or selective information. Folks who are young saying, I'm low risk. If I get sick, I'll be fine. But they're completely disregarding the fact that they could spread it to other folks. It's really simple stuff that we're trying to relay. It's not just about, the young people getting it. It's about you as a vector. And this is how pandemics spread, right? The asymptomatics, the young folks who are not as sick, but they're going to spread it to the older folks who do get sick. And that's what's sometimes it's missed. People are like, oh, this is a boomer disease. This is not affecting me. I'm not, why am I worried? Why should I isolate or distance myself? But you got to remember that, everyone plays a piece of the puzzle. Even though you may not be the one who dies, you're going to be probably responsible for someone else if you don't follow the rules. So we're sort of in it together mentality. Unfortunately, the climate of our land has been such division. I think that was infused into this whole thing. It was hard to have one person say what they think is right and what's the best way to go it without another folks kind of misconstruing that and taking, trying to do the opposite based on some, misguided ideology.
What do you say to people, and I get this, virtually every time I post something on my social media about COVID or about free testing that's available in certain places, or what some of the latest developments are, people are like, that's not really real. In communities of color, it's extremely real because the death rate has been so much higher, the case rate has been so much higher, but there's still this notion of like, it's not real. What do you say as our medical expert to that?
I mean, it's just silly. I mean, these are people who are not exposed to it. They're not professionals. Like, why are you suddenly the expert in telling me what's real and what's not? And these stupid posts of people taking a picture of a hospital. Oh, the parking lot's empty. There's nobody there. Give me a break, guys. All right. All you got to know is talk to the docs who are in the hospitals. The hospitals in various regions are super full. Not everywhere. It comes in waves. So just because you're not seeing it doesn't mean it doesn't exist. And honestly, that's insulting and demoralizing the folks who've gotten affected, whose families have gotten affected, people who've died. I don't understand why people would say that, right? It's frustrating, as you can tell. And, it's almost like, how you respond to something that doesn't make any sense. It is real because it's actually happening. But it's crazy how these conspiracy theories have gotten so rampant, Yeah. And it's just, and they fly and they get all this distraction on social media, and then people believe it just because in their town they're not seeing it. Well, it's not like everyone's rolling into the ICU to see it, so why would you be qualified to? So I almost don't understand it. I don't know, maybe Dr. GARDERE can explain why is this happening in society's aspect.
Lisa, may I answer that?
Yeah, please. No, you don't have to ask permission. Just jump in, please.
Of course. Well, part of what I'm seeing, and I think Dr. Hayter does have the answer, but I guess he's, passing it over to me, and I'm happy to take it. We have to look at what happened with the federal government, right? A lack of leadership. What happened with, the CDC, which was, something that was in many ways the holy grail. What happened to those institutions? Quite frankly, we politicized COVID-19. This is the thing that we have to look at. We politicized it. We allowed it to become political. We are in 2020 and we're talking about we don't believe in science. Well, yeah, we believe in science and we believe in love.
Tokyo, in terms of your own case, like, did you find people, after you got sick the second time, did you find people that were in disbelief, or they were like, oh, you just had the flu, or they didn't want to practice safety measures around you or wear a mask or anything?
Oh, well, I'm not a real chatty person. Like, I kept my COVID to myself. I kept myself to myself until I was fine, even like before I got sick, like, I wouldn't go home and visit my mom. My mom has had open heart surgery twice, and she's had a brain surgery. I'm not going to visit her. Like, I'm not young. I'm not going to visit her. I'm young. I'm fine. I'm healthy as a horse. I don't know. You could be a person who not having any symptoms, and you go home and bring it to your family, and it kill everybody. But I also do feel like, in the Black community, Hispanic communities and stuff, I feel like our death rate is higher because when we enter the hospital, I don't feel like we're granted equal opportunity. So, I don't know.
No, and to your point, Dr. Hayter, the American Medical Association really recently just announced, or whatever their official way of doing it is, they said that the racial disparity in the healthcare system was a public health threat, a verifiable public health threat.
Absolutely. I mean,
Explain that to us. What does that mean, and what are the ramifications?
yeah, I mean, what Tokyo says is on point. I mean, there's bias. There's inherent racial disparities with delivery of healthcare, right? And whether it's conscious, unconscious, it exists, and we've seen this, and this has been evaluated at the level of, you know, African American pregnant females who get very sick. We've seen that in cardiology. Just recently, I've been working with, you know, someone to work on a post about looking at the healthcare disparities of race and cardiology. Female Black women are offered less invasive procedures for certain heart disease than white men. I mean, you know, and this is stuff that you don't think, you know, on a day-to-day basis. You think everyone's getting treated equally, but it's one little, you know, inherent bias after implicit bias after another that adds up.
Tokyo, in terms of the, what would you say? Give us your biggest, you know, your top 2 biggest lessons that you think you've learned from this year.
It's just to actually, well, really my biggest lesson that I learned was actually to we have to all take accountability for the part that we play in this pandemic, you know, and everybody kind of want to point the finger, but it's everybody. It's the glove users that don't know that you're supposed to keep switching the gloves. It's the, you know, like, yeah, you're cross-contaminating. You touching everything at the store, touching your car, touching your phone, bringing it back, like, you know, it's everybody. Everybody plays a part, even the people who are not properly quarantining, because all of this, it boils back down to education. And a lot of us, we're only half educated on this. We're partially educated, and it's just sad because honestly, the world is never going to take this pandemic and this sickness serious until it personally affects them or somebody around them. Like, they have to lose a close loved one to COVID to know it's real. They have to almost lose their life to COVID to know it's real. None of my friends, when this first came out, none of my friends believed in COVID until they started catching it, until their kids started catching it, until their aunts and their grandmothers was taken away from them due to COVID, until some of them lost their parents. Then everybody became COVID activists. But it's because but that's everything in life. Things have to personally affect you. You know, the average person, things have to personally affect them for them to take it serious. Even going back to the first topic, you know, going back to, you know, colorism and racism. A lot of people, it doesn't really affect them for real. So they can't really see, like, they're not scared when their kids leave the house that they're going to get killed by a police officer for pulling some candy out their pocket or something. You know what I'm saying? So it doesn't affect them. You know what I'm saying? So
it's about that personal experience is the real way to do it. Dr. Jeff, what are your top lessons? You've given us some throughout this year of 2020 with mental resiliency, with just kind of putting on that mental equipment just to know that things are not going to be the way that they are. What are some of the lessons you've learned that you can share with us?
Well, I guess the major lesson that I learned is to stay woke, keep your eyes open. It's not what people say, but it's what they do, as my friend Rachel Maddow likes to say. And it's really important that, and I echo what Tokyo has said, we all need to take personal responsibility and become global citizens in order to beat COVID, and just as importantly, achieve social justice and end racism.
All right, and Dr. Hayter, in terms of your lessons learned that you can share with us.
Sure. And I agree with both of them. The accountability thing, I think that's great. I think this is a perfect example how, whether you're far away or close from it, we all play a part in it. And I think that exemplifies how, as humans, we need to all work together to live and stay together, right? And, you know, the other thing I'd say is, you know, what I've learned is, you know, don't take for granted the simplest things, right? You know, being able to see your parents, having dinner with your family, visiting your nephews, you know, family stuff, just we take for granted. It was revealed to us in these times of isolation. And even in the medicine side of it, you know, the most simplest thing, the mask, the face covering. Remember in the beginning, we had no PPE, we had no mask, the simplest yet most effective barriers that no one would have thought twice about, Yet the cheapest thing out there, the cheapest thing of all these medicines we're doing, we had a lack of, and yet you take it for granted. So sometimes it's the most simplest things in life that are right in front of us and cheap and low tech that we sometimes take for granted.